and hopefully we'll provide you some useful information for you in your cycling adventures. And as you can see the topic here, we're going to talk a little bit about treatment and prevention of cycling injuries. And primarily we're going to kind of focus on, as a cyclist, where you can go for treatment, what can be done for treatment, some considerations for you as far as cycling, preventing injuries, as well as treating some of the things you might encounter along the way. So, my name is Shane McClinton. I'm a physical therapist here at the Des Moines University Clinic. I also coordinate our running and cycling clinic. And the point of our running and cycling clinic is to let individuals like yourself know that there are places for you to go and to see people who understand some of the concepts and the issues that surround cycling, both from a medical perspective as well as from a personal perspective as someone who also cycles myself too. Basically, I wish I could say I was that guy on the right-hand side of Lance, but my cycling experience primarily has been recreational as well as a kind of a commuter cyclist and utility cyclist. So most of right now, currently, this is more of what my ride looks like. And I apologize, I couldn't get my own picture up there yet. We haven't got it quite put together yet this season, but I've got two boys and they just love to ride with me, and so it's definitely a family affair for me, and every time I'm out they want to be with me. So I've got some luggage in tow every time I go, but it's good for strengthening the legs. So a little bit of the outline of what we're going to talk about. If any of you attended, we had a presentation on running injuries. And as far as the running injuries are concerned, there's a lot more literature regarding risk factors that are associated with injuries associated with running. So when we get to the cycling literature, I'm less able to present that because it really just isn't out there. I mean, a lot of the literature as far as risk is mostly associated with risk of getting hit by a bus or a car and those types of things. So mostly what we're concerned with here from a rehabilitation standpoint, not that we're not concerned with those types of things, but more of the non-traumatic type issues that are related with cycling, some of the sprains and tendon-related issues that are associated with that. So we'll talk a little bit about how often these injuries occur, where the most prevalent locations of injuries are, and that'll allow us to talk a little bit about the treatment and the certain considerations that we need to take into account when we're trying to address issues that are related to cycling. Now we'll leave this pretty casual, so if you have questions, feel free to kind of get my attention and we'll kind of address those along the way. We'll also try to leave some time at the end to address any further questions that you might have. So I relate this very similar with runners as well. I mean, as a cyclist, there are very unique needs and demands of cycling which need to be addressed differently than any other issues of people that are non-cyclists, or individuals with knee pain that are not cyclists are different than runners with knee pain. And so we need to kind of take into consideration the sport itself and how it might relate to injuries to best address those issues that you might have that are related to cycling and to get you back on the road as soon as we can. And it's also important that your medical professional be aware of some of those issues and be able to relate to that. Okay? Sometimes if they're not, oftentimes the advice will simply be just to avoid it or to stop altogether, whereas if you talk to someone who may have a little more experience related to cycling, they might be able to offer you solutions that may allow you to overcome your issue and your injury without necessarily abstaining from cycling altogether, or avoiding it, or eventually at some point even giving up with it if the issue persists for long enough. And I think another thing to consider with cycling, when we consider tests and seeking medical care in that regards, is the fact that cycling is a movement-related sport, of course. And oftentimes the tests, when we look at injuries sometimes in medical offices, we look at things statically. So we look at you standing, we may move the joint around or the limb or the injured area around a little bit, but sometimes you really need to look at the injury specific to the context in which the injury occurs. Okay? So if it's cycling and occurs while you're cycling, well, it makes sense that at some point in time we have to look at that person on the bike and see exactly what's going on. Okay? And the same thing I relate with runners as well too. You need to look at things within the context of the environment that the issue arises. And these are things that x-rays and MRIs and even sometimes the physical examination within the clinic cannot necessarily tell you. Okay? So if you do have some issues that are going on, and it may seem like the tests and the things that are being done are not really getting at the heart of the problem, it may simply be that you're not seeing someone who's a movement-related specialist that's able to identify the issues that are specific to that movement. Okay, such as cycling. So we can somewhat identify risk and somewhat identify the problems by kind of knowing what problems are most prevalent. So when we look to the literature on injuries related to cycling, you can see that a large majority of them are kind of the saddle soreness type issues. Okay, and most of us have experienced that to some extent over time. time. Another one that's fairly high up there is our knee injuries. And again, there's kind of a wide range in literature because much like with any literature regarding injury, the definition of injury can be different amongst the studies. Okay? And also the population you study can be different. So some of these studies may be in elite cyclists, some of these studies may be in recreational cyclists, which are two different groups, and so you'll see differing ranges of injury prevalence. But across the board, we're seeing the knees be a fairly commonplace, we're seeing the back being a commonplace, head and neck, as you can kind of imagine, as well as in the wrist. And most of those in the wrist and hand are usually related to sometimes some numbness and tingling that typically happens in the fourth and the fifth digits, so kind of the pinky side and the ring fingers. So just looking at another article, a little more recent, this is just a single study, whereas the slide I showed you before was a combination of several studies that kind of demonstrated those ranges. This just also just kind of outlines a similar relationship. In this situation, they kind of lumped the low back and the pelvis and hip together. So on the other slide, it kind of had the buttock as the number one category. In this case, it kind of combined the buttock with the low back together. And so you'll see that encompasses the majority within this study. So the large kind of bluish area there is the low back and the pelvis and the hip, which includes the buttock. And then I'm sorry the colors are a little hard to see from where you are, but the second category is the knee. That's the second largest, and it actually goes down in order. So if you read those from the top to the bottom, the top is the most prevalent, the bottom is the least prevalent. And then you can see along the season, as far as where those injuries can occur. But the interesting thing is that when we look at just the low back and the knee, this study kind of focused in on that because that was kind of the two areas that seemed to draw out as far as where the most prevalence as far as injuries were occurring related to cycling. And the knee injuries were most likely to cause lost time of cycling, but the low back was the one that most people went to see medical attention for. Okay, so the knee might be more common and take you out of cycling more often, but the back is the area where most people had kind of more limitations that sought them to seek medical attention. So you can kind of stipulate in some regard that many of us as cyclists are kind of pushing through this knee pain and maybe not seeking care for it. And I will tell you from my standpoint, there are oftentimes a lot of things that can be done about that. Okay, and we'll talk about some of those things as we go along here. So this just kind of goes to show that this is what most of the literature looks like when we look at risk factors. It's mainly regarding how likely are you to have a traumatic event, hitting a vehicle or things like that. In this case, experience does seem to make you less likely to have an accident, but mostly what we're going to focus on are the non-traumatic issues. And there are many things which are maybe thought or we can stipulate could lead to increased risk of injury. Some of that might be related to the gear that we have. So what's our bike like? What are we putting on our bike? How are we affecting our position on the bike? Stretching and strengthening is often something that we think about that might prevent injury. And we don't know much in the cycling literature, but when we look to the running literature, in some cases stretching can kind of reduce risk of injury. In other cases it actually can increase. And a lot of times what we find is there's kind of a dichotomy of individuals as far as their flexibility. There's some people that are overly flexible, some people that are really inflexible. And those might be the ones with greater risk, but then there's a population kind of in between. And for them, stretching really isn't too preventative because they're not on either side. So when we look at them as a whole, it tends to wash out and you really don't see much of a difference related to stretching. But I will tell you from a clinical standpoint, addressing flexibility limitations is an effective solution for some individuals that have pain and have injury. And that's somewhat regardless of sport, whether it be cycling or running or any other activities. But other things to think about are nutrition and hydration. There's definite factors, especially when we look at, and more in endurance related cycling, that can lead to fatigue, and fatigue sometimes can lead to altered mechanics, which can lead to strain about your tissues and cause problems in that regards too. So all these things need to be considered when we talk about injury risk as well as rehabilitating from an injury. And this article came out recently, and I found it to be quite interesting. Core stability is a really hot item altogether in the fitness wellness field. And this study looked at the effect of core stability on range of, or basically the changes in motion as you cycle. Okay, so they took these individuals and they made them do fatiguing bouts of cycling, and in between it, they provided them a fatiguing bout of core training. And what they found is after they fatigued their core, their cycling mechanics got, you could say, sloppier, okay, which kind of makes sense, right? But I think sometimes in cycling we think that since our butt's on the bike, we don't have to worry about what's up top and its effect on our cycling performance or mechanics. And this study just kind of helps to remind us the fact that it does matter, and a stronger core, and I would argue even a better balance on your bike, can not only improve performance, because if you're unbalanced on your bike, if you think of the path that you're going to travel, it's going to be wavering. And you're technically going to be riding more miles, okay, with the same amount of energy that you're expending. Whereas if you can have better balance and ride more of a straight line, stay a straight course, you're covering less ground and being more efficient. But we also see some changes as far as what the knee is doing. And one thing to point out here that I would say oftentimes can be problematic is that knee wavering in and out, okay, which can cause maltracking of your kneecap, and oftentimes then causes some of that knee pain, which we already know is a more prevalent finding in individuals who are cyclists. So when you consider your exercise program and kind of your cross-training outside of cycling, I think it's important to consider the effects of your core, so kind of strengthening from the top of your thighs through the top abdominal area, kind of keeping that fit. And there are some ways in which you can do that specific to being on your bike. So while in this presentation we won't have a lot of time to really talk about the specifics on how you address any one injury in general, we'll talk about a few things just within context, such as this, but feel free to ask questions if you want to know a little bit more about something specifically. And of course, you can consult your therapist about some of these things as well for some further information. The other thing that was interesting with this too is a common finding, and this used to be something that was taught, but we kind of find that it's a less efficient pattern, is this ankling pattern. And ankling essentially is, as you ride through your pedal stroke, it's using your ankles to kind of push at the bottom, or to basically letting them flex at the bottom, and you're pumping with your ankles around the pedal, rather than your ankle staying fairly in the same position all the way around and using your thigh muscles to press the pedals and pull the pedals around. Okay, so ankling is just more movement at the ankle, using your calf muscles to kind of push you through a little bit more. And we see that as they went through this fatiguing exercise, it had effects not only at the knee, but it had effects at the ankle, and they tended to do more of this ankling pattern as they were fatigued closer to their core. So, and again, we've got some nice EMG studies that really demonstrate that ankling isn't a very efficient pattern. Okay, you're using smaller muscles to do more work, which just doesn't work out very well. So this slide just kind of nicely summarizes some of the common issues that we find, and I'll go through some of those terms that are a little more medical than probably are for your need to understand. But oftentimes as we start from the top on the left side and we'll go down and then we'll get off to the right, the neck and shoulders, very common to have neck strain in that area, and a lot of that kind of depends on your position on the bike too. So, if your upper back is kind of stiff and kind of rounded forward, your neck has to go the opposite direction to keep your eyes on the road, okay, to look out for other cyclists. And that can cause a lot of undue strain in through there. So there are some things you can do to kind of help address your upper back, as well as to address your positioning of your neck so that you put less strain to that area. Okay? The back in general, starting from the mid-back down, again, you can tend to have some stiffness just due to your position on the bike. Okay? So the roundedness of your shoulders, some of that can relate to your bike fit as far as how far you're reaching, how much that puts you in a position that can become stiff over time. Sometimes simply due to what our work environments impose upon us on a daily basis, we may be stiff there in general. Okay? And then cycling might only propagate that and create some issues with that. And of course, one of the things to consider too is that sometimes these issues that we have are not simply just cycling related. We may have some other issues. We may have disc pathology or pathology of the joints in our back that we had maybe even prior to starting cycling, or it's gotten worse over time and it's just causing us more problems with cycling because that's something a little more rigorous that we do that puts more demands upon that area that it's just not quite able to tolerate. So that's also why it's important that we do consult a medical professional with some of these issues so that you get the appropriate diagnosis and the appropriate treatment, which can include cycling-specific things, but also some other complementary things that need to be done from a medical standpoint. So, and then we kind of get into that saddle soreness, and I'm sure we've all experienced this to some regard. There's a lot of things that can go into preventing this. A lot of it can pertain to proper attire. As far as cycling shorts are designed like that for a reason. They do serve a purpose, as well as some of the other lubricants and stuff to help keep that area comfortable and without too much chafing, and which can create some of the other issues you see there. Selection of the right saddle, which is more of an art than a science, can make a big role, and a lot of that can involve some trial and error, but there are some individuals who can consult you on that and help you improve in that area as well. The wrist and hand, a lot of those issues are related to how bent your wrist can be, in what position you are, whether you're on the top, whether you're in the hoods, or whether you're in the drops. And a lot of times the issues in the wrist and the hand are mainly that nerve related. Sometimes there could be just specific pain to the wrist, but more common there's compression that happens upon the nerves, particularly on more of the outside of the hand or toward the pinky side. So if you're getting some numbness in there, again, there are some things you can do. Wearing gloves does help, but also it might just be how you're holding onto the bike, or maybe it's how you're fit onto your bike. Maybe you're not positioned correctly from the kind of waist up, and so that's affecting how you're holding your hands on the bike and putting compression on those nerves that causes some of those sensations. So the knee, we'll talk about that a little bit more, because that's kind of more of a common area. We've got some more literature regarding issues that are around there. But knee pain a lot of times can be related to, we talked a little bit about the core fatiguing. So what's your strength, your baseline strength like, flexibility. But it also can be related to your position on the bike. So oftentimes if your seat's too low, it has a tendency to cause more pain in the front of the knee or the kneecap area. If the seat is too high, it has a tendency to cause pain along the outside of the knee, or that infamous iliotibial band, which can tend to kind of rub over some of the structures or the bones in that area. And then the lower leg issues are related to the heel cord or the Achilles. We'll get some numbness and tingling there in the toes. Some of that can be related to, again, bike fit. Some of it can be related to shoe fit. And then actually having pain along the bottom of the foot can happen as well. There's not as much impact with cycling, but it's still not uncommon to have pain that might be related to the bottom of the foot or the bottom of the heel related to your cycling activities. So injury management. I've alluded to this a little bit, but again, it's kind of appropriate that you get the right personnel involved to help you identify what the cause of the problem is. And there's two primary ways we can kind of classify the causes of injuries. External and internal. So external might be things outside your body. Okay, so that's things you wear, so that can be your attire, it can be your bike as well. And we're not going to get into a thorough details about bike fit. We'll talk about it a little bit, but also talk to you more so about where you can go if you need assistance on fitting a bike, because it's not quite as easy and simple as it may seem at first. So the things where you will need some healthcare professionals or some medical advice regarding is the internal component to things. So these are specific pathologies, specific injuries related to your joints or tissues, of which may require some medical attention. And again, from my perspective, assuming it's a non-traumatic event, okay, of which is primarily movement related, a physical therapist, because our expertise is in movement related sciences, is a very appropriate individual to consult regarding these issues. So the tests and measures that could be done from an external perspective, looking at the bike, again, I think it's important, if the things are very specific to you and your bike and your injuries are related to that we need to take a look at how your bike's set up and how you're fitting on your bike. Okay? This can involve video analysis, so actually watching you ride, taking a video of that, breaking that down a little bit, slowing it down so you can really analyze some of these movements that might be occurring. Okay, so the example of that core fatigue where they saw that knee wavering in and out, they use three-dimensional analysis to do that, but it's pretty easy to see that just slowing it down on a video camera. Okay, so you sometimes don't need a real extensive amount of technology to actually make these assessments. We do have the capacity to do a three-dimensional analysis, but I will tell you that almost 95 to 99% of the time, a simple camcorder can do the job if you set it up correctly and know what you're looking for. So And then the kind of internal component, that comes from a physical examination. So looking at you and doing tests and measures on your joints and ligaments and tendons and the tissues that are involved to really diagnose what the problem is, and then from there treatment solutions can be provided knowing what's going on. So it oftentimes provides a combination of the two. Sometimes there's further imaging that needs to be done. And these are usually things now when we talk about imaging, talking about things like x-rays and MRIs and EMG, which is a nerve type testing. So sometimes in the hand and wrist we talked about, and sometimes even in the kind of pelvis area we get numbness and some of those sensations. And to actually identify where that numbness is coming from, EMG or nerve conduction velocity tests are appropriate to facilitate the decision making in those processes. All right, so we'll touch a little bit on bike fit, but again, we're not going to go through the entire bike fit process, but I will give you some resources as far as that's concerned, should you think that you need some further assistance in that. So a couple things to consider if you're seeking consultation for bike fit, or if you're performing your own bike fit. Okay, static versus dynamic. So static meaning taking the bike fit with you simply sitting on the bike where the bike is stationary. Okay, and for the most of the examination you're not moving. So again, probably most of the time my examination of an individual on a bike includes this at least as one component. Okay, and this involves the way that I do it, very specific and reproducible measures in certain positions, looking at things like knee angle, looking at your ankle angle, looking at your cleat placement, and where your cleat placement puts your foot over the pedal, as well as looking at kind of what we call the cockpit position, which is a position from your waist up. So how are you hovering over your handlebars? How are you positioning your upper body? And a lot of these things then are specific to the injuries that you have too, so we'll spend more time on one or the other depending on what's going on. So dynamic then is actually taking those measures, but while you're moving. Okay? And so that does then require a camcorder, which you can slow down, and then you take the measurements on the screen. Okay? And it can be the same measurements, but you take them kind of live. Okay? So when you're static, I mean, you try to get somebody positioned on a bike and get them in their comfortable position on the saddle, but then when they stop and you take the measures, we all shift a little bit, and so that can kind of change your measurements there, whereas the dynamic one really tells you where the person is actually while they're cycling. Okay? But we also know that we do shift on the seat, and you should shift on the seat. That does keep things from going numb down there to some degree, and helps keep you more comfortable on the bike. But we can see that better with a more dynamic bike fit. So there are many bike fit methods. I listed just a few up there. And again, my training comes from a couple of physical therapists primarily with kind of the same background. Kind of an interesting combination. One of them is mainly an exercise physiologist who's married a professional cyclist who's also a physical therapist. And what they did is they've taken some of these common bike fit methods and some of the things that we see out there. A lot of it comes from Dr. Andy Pruitt, which, if you're familiar with that name, he's got a great book on which includes some bike fitting, and I'll give you that reference at the end. But they also went and they looked at professional cyclists, and they kind of just looked at a whole bunch of them dynamically and measured where they were on their bike, where their knee was at certain angles. And they've then basically created a method of which to precisely measure those things based on some of those standards. So it's not perfect for everyone, so that's why we need to kind of consider you as the individual, what specific issues you have, how your body's put together, but then look at it within the context of you on the bike, okay, and make adjustments accordingly to see what's working and where maybe the optimal position might be for you. So the individuals that do this, again, there are some therapists that have some training to do that. I wouldn't say everyone is, but definitely there are some therapists that do have some training. But your local bike shop is a great resource to start with. If you just need kind of a basic bike fit, you're kind of wondering, just you need to get pretty close. And actually some bike shops will get you very close, by the way. I shouldn't make it sound like it's inferior by any means. The only difference from my perspective is those individuals typically don't come from a medical background as a licensed healthcare professional if you have specific medical pathology that needs to be addressed. But they can do a great bike fit, and they oftentimes will use one of these systems. Okay, so definitely consult your bike shops regarding that if you've got issues. The other thing that's important about a bike fit that a bike shop does offer is oftentimes when you make adjustments on the bike, there are sometimes you need to change out equipment, okay? And the bike shop has all that stuff. Whereas as a physical therapist here, if we find some things, I have to send you to your bike shop, which is perfectly fine. But definitely there needs to be collaboration amongst professionals in addressing bike-related issues when it comes to bike fit. So, just again, speaking in general, without getting into things into too much detail about the bike fit itself, this is a brochure that comes from our association, the American Physical Therapy Association. And I apologize, it is a little small up there, but there is a link up there, and I can get that to you later as well. You can feel free to email me, and I'll give you that at the end, or you can take a card, which is out front. But a couple things we look at. Again, the primary thing is that knee angle. And the knee angle should be somewhere between 25 to 35 degrees when you're at the bottom stroke. So when the crank arm is completely vertical at the bottom, knee angle should be somewhere between 25 and 35 degrees, roughly. Okay? And that kind of depends on your own flexibility. The ankle itself is relatively fixed throughout the pedal stroke. We talked about the ankling strategy and how EMG studies have really shown that that's an inefficient way to pedal by having your ankle pump up and down through the pedal stroke. So the angle of the ankle should be somewhere between 0 and about 10 degrees, probably closer to that 10 degrees than 0, but somewhere within that range. And do understand your ankle does move a little bit. So at the top of the stroke, your ankle does bend a little bit. At the bottom of the stroke, your ankle and your foot kind of point down a little bit more. But for the most part, that shouldn't be a real obnoxious and significant movement happening at that ankle. The trunk angle, which is kind of the angle of your back, essentially, you can think of that. That is really relevant to the rider. So obviously, if you need to be in a more aero position, we need to have more flexibility through your back and your hips to achieve that. But some people will have a significantly greater trunk angle than others. And again, same thing for the shoulder angle, which also dictates kind of the angle of your head. Okay, so the greater that angle is, the more your head's going to have to kind of arch and look up, and so therefore the more flexibility and mobility you need to have in your neck to be able to achieve that. So there are images both for kind of mountain and road bike there is all that points. Mountain bikes are, for the most part, what we call the power plant position, which is from the kind of hips down, is similar, okay, to the road bike, but usually what changes is that trunk angle, and then of course the shoulder and neck angle changes quite a bit on the mountain bike. And actually this is kind of more of a hybrid type bike, which is fairly commonly used as well. So now just talking again fairly similarly, again, if you had any of these issues, we would of course address the area more specifically by a physical examination put in combination with the bike fit. But in the neck and shoulders, oftentimes the issues are related to that cockpit position. So what's the position of kind of from the waist up? How are you hovering over your handlebars? And there are some things that are fairly easy to fix that oftentimes can be problematic, which just includes bar position. Okay, so are your handlebars rolled too far forward or rolled too far back? Where are your brake or your hoods placed? That might dictate where your hand position is, which also dictates then where your upper body is placed. So some of the things that I do first is just kind of check your bike for some of these standard things like, is your seat level and are the handlebars kind of at the appropriate amount of roll to start with? And then you kind of work things from there. So again, you can imagine back pain similarly is going to be related to cockpit position. But the other thing to consider is the power plant position. So actually what your legs are doing are going to dictate some of the forces transmitted through your back. Okay, so if you're too high on your bike and you're really reaching for the pedal at the downstroke, it's going to tilt your pelvis and your back's going to be kind of teetering throughout the ride. And you can imagine that that's going to cause some overuse and some wear that might cause some pain through there. So the other thing as far as the back is concerned too can be fitness, and that includes fitness levels of your legs and your arms. So did you not ride your bike all winter and then get on your bike now and expect yourself to ride as much as you did at the end of the fall last year, or you just and you haven't built your conditioning up to tolerate that yet? So a lot of issues sometimes, especially I would say saddle soreness, is a lot of times a conditioning effect. Your legs aren't conditioned to the point to where you're unloading your seat a little bit and you're sitting heavy on your seat a little bit, which causes that type of saddle soreness. So, and then again, we talked a little bit about the wrist and the hand. A lot of it's attributed to how you're positioned from the waist up. but also weight distribution. And that depends upon where you are. And again, I'm speaking a lot of times with regards to a road bike, because that's most commonly what most people will ride. But on a road bike, if you're sitting on the level part of the handlebars, you know, the weight distribution is about 60-40. So 60 is kind of on your seat or through the pedals. 40% is actually through your arms. So there's a fair amount of your weight that's actually, you know, pushing through your arms. As you go onto the hoods, okay, that goes to about 55-45. Okay, so you've got a little more weight now onto your arms. And then if you go down in the drops, that becomes now about it goes into being about 50-50. So half the weight's through your arms, half the weight's kind of through the seat and the legs. So, you know, your weight distribution then has an impact on your bike, and some of that can be dictated by the size of your frame and the position of yourself on your bike. So the knee, we've talked about this a little bit. We've talked about the height of the seat having an impact on the knee, as well as fatigue. Okay? Some of that comes into force production, which is the last thing I listed there. But also cleat position. Sometimes clipping in and out, we don't realize it, but our cleat gets twisted, and therefore when our bike and our foot's twisted, even regardless of what our float is, and your knee is kind of twisted during the ride, and that kind of wears on it over time. So it's important to kind of make sure every once in a while to kind of look at your shoes, put them together, and make sure your cleats are still aligned as you installed them to begin with. So, and then the lower leg, a lot of that can be, again, due to conditioning, as well as shoe fit. So here's another thing to consider when we talk about injury as well as rehabilitation, and that's kind of force production. So this is where the science of cycling plays an important consideration, and that is any time that our force is about 90 degrees to whatever angle our crank is at, that's where we have the greatest potential to produce the most force. And if we have an angle that's anywhere different from that, we're kind of wasting our energy at that. So most of the times, we're pretty good at pushing straight down, and we're pretty good at pulling straight up. So most individuals need to kind of smooth out that point where we call the upper hemisphere. If you divide the cycling stroke, and again, just to orientate you, if you're not there already, you know, this would be the axis of the crank, and this would be the crank arm as you go through your pedal stroke. But that upper hemisphere there, then, where most people need to work on is that 0 degrees at the top, trying to think of going up and over, okay, so that their force is going perpendicular to that at that phase. And then oftentimes the pushing down is pretty easy, but then on the bottom side, pulling down and back and through is the other thing that we need to focus on, and kind of evening out our cycle stroke. And this is one thing that's really kind of hard to assess on your own. But there are some tools out there that can assess this if this seems to be a problem. Okay? So oftentimes you can just simply train yourself by doing drills, by kind of doing what I talked about, working on going up and around and down and through. But if you really think it could be a problem, there is some software, and this is just an example of one that comes with a CompuTrainer, which is basically a stationary system you can put your bike up to, and will kind of measure things as you're cycling. And this is one of the neatest features of it, I think, from my perspective, is you can do what's called a spin scan, and you can see at any point throughout that pedal stroke how much force you're putting through the pedals on the right side and the left side. So the nice things you can look at is you can look at and see, like in the top picture here, this is an individual doing kind of this mashing pattern where, you know, they basically like to push down, and so they're pushing down all the time, but they're really not expending much effort throughout the rest of the pedal stroke. Okay, and they'll probably oftentimes will have a lower cadence. They'll be riding, you know, at lower revolutions per minute. And with that, you'll see again that mashing occurring there. But then the rest of the pedal stroke, and you'll notice where the gray bars are. That's the other side. Okay, so on the left is the left, and where the other gray bars are, the smaller ones, that's the start of the right side. Okay, so those are left and right kind of put together so you can compare them for symmetry. So if you do some training, then you can get that to even out. Okay. Now it's never going to be completely level because we're always going to be more efficient at kind of pushing down and pulling. Okay, so it's never going to be completely there, but in theory, okay, based on biomechanics, the flatter that is, the more efficient it is, and the more power you're able to generate with the least energy expenditure. So this nicely allows you to do it. The other thing that I think is nice about this is let's say you've got a right knee injury or you've got a right foot injury, whatever it might be, there may be some asymmetries in how much you're using your right side versus the left side. Maybe you're overusing it, or maybe you're underusing it and it's weakening over time attributed to that. This can kind of nicely assess for asymmetries with something such as this on the right, kind of a peanut graph with the spin scan, where you can see if we split the hemispheres here, again, this is the right side, the left now is the left side, and how big that circle is a matter of how much you're using that side. So this individual is very right-sided dominant, and the left side isn't contributing very much. So unlike running, if you were doing this in running, you would just run in circles. But on the bike, it kind of negates that fact. You'll still go in a straight line. And so it's very hard to observe that unless you see something like this or use something like this. Now sometimes with a very sensitive and a very trained ear, you can hear that based on the whir of the chain and the whir of the wheels a little bit. But this just gives you much more objective data. Now, staying on the lines of symmetry, that's something that we oftentimes consider a lot of times with running and with cycling. And this article kind of goes over a nice little review regarding injuries kind of related to pedaling symmetry. So some of the things we talked about, how much force you're producing with your right side compared to how much force you're producing with the left side. And what they found is that it's very common, actually, to have some asymmetry. A lot of us are right-handed, and very similarly, we can be right-legged or left-legged for that fact, and that is reflected then in how we cycle. And as you can imagine, that can lead to some imbalances that could put some undue strain. So with enough mileage, with enough repetition of that asymmetry, if our bodies aren't trained or conditioned for that to some extent, it can cause some undue strain and result in injuries. Some of these tendon-related issues or muscle-related issues may start to come out. So there definitely was a tendency towards limb preference. So if you are right-legged, you're going to produce more power with your right leg. But some of the questions that still are left to be answered that are somewhat varied amongst the studies were the effects of cadence on symmetry. So for those who had a higher cadence, a lot of times you'll see higher cadence is favorable in some regards. So the more revolutions per minute you can put in, closer to 100 revolutions per minute or so. In some studies that showed that seemed to balance out the symmetry, but in other studies it showed that it actually made it worse. So again, it's really kind of a toss-up right now. We don't know enough to know if increasing your cadence will actually maybe resolve some of these asymmetries. There is a potential for that to be the case, but we really don't know yet. Similarly, intensity. In some studies, if they made you exercise at a higher intensity, then things evened out. They kind of forced you to use that limb that you weren't using, kind of pushed you to that point. But in other studies, it kind of seemed to make it worse. So maybe their body just couldn't keep up with that, and it made that discrepancy even worse. So we also don't know what the effects of fatigue have on it. Okay, so much like we saw with the core, is going to make that asymmetry worse, or might maybe even make it better. Or how about experience? So people that are more experienced, are they going to be more able to have less of these asymmetries? Or will we find some of the similar findings even in those who are well-conditioned and well-trained? So keeping with the symmetry component to things, one of my observations, and again, this is primarily my anecdotal evidence, we don't really have any further evidence to support this, but we find this kind of in general as far as rehabilitation and some of these factors that we hear may be related to injury as well as injury rehabilitation in cycling. But oftentimes the levelness of the pelvis, when looking from above, can contribute to these asymmetries and sometimes issues that are related to your pain. So this is not a perfect picture from above, but if you look at the red lines there and you look at their pelvis, I've kind of drawn a square line there of which then the legs operate very squarely from that pelvis, seated on the seat and parallel to the bike. But if our pelvis is twisted, for example, you can see how that's going to affect the legs, and they could respond one way or the other. They could try to keep the legs a little bit parallel to their pelvis, how they're twisted, but then you would see one leg kind of rubbing up against the tube or getting closer to the tube, and the other leg's going to be further away from the tube. Okay? And you can imagine how that's going to cause torque about the knee, even around the foot and ankle, even in the back. It can cause some undue strain in that area. The other compensation could be maybe they'll keep their feet level, But you can imagine how much they're twisting then at their pelvis, and that might relate to more back issues or maybe even hip issues because there's more torque occurring in that area. So I think with this, we really don't know necessarily what might cause that. I will say that just sometimes with some of the individuals that I've worked with on the bike that have had some issues, we seem to find some of this tendency. And the individual on the bike has no idea it's happening. And when you straighten them out, they feel crooked. Okay, so it's more than just, you know, tightness and that type of stuff going on. Your body and your brain has kind of changed and adapted to that position, and it has no idea that it's kind of crooked of sorts. So that's, again, a good example of where sometimes you need someone to kind of point those things out. You need some specific training or retraining in order to correct the issue. So what can be done for some of these internal issues? So we've talked about some of the external issues, you know, differences in force production, bike fit, and things like that. What about some of these internal things? And speaking from my perspective, as far as a physical therapist, you know, where we diagnose and treat many of these musculoskeletal related or even neurological conditions related to some of the numbness and tingling and things like that, one of the things that we can utilize can be hands-on treatment. So actually working on that affected tissue and trying to facilitate its healing, or maybe reduce the restrictions that are inhibiting you from moving in a more natural manner from which your body requires to actually recover from that injury. So exercise then oftentimes as a good complement to that manual treatment. So if we do have restrictions or impairments and we allow them to move, it's important to retrain that area so it knows how to maintain that movement. It provides proper nourishment to those tissues and again helps to facilitate healing. Or in the case that we saw before, the kind of the core stability, there's sometimes that area needs to be built back up. Or if you're seeing force asymmetry through the pedaling, again, we need to build up that area that might be lagging behind so that we can allow your body to perform in a manner which doesn't put undue strain on your tissues and allow for any of these pain or injuries to persist. So the one thing I think that oftentimes gets missed on a bike, because we feel like we're on a bike and we don't need it, is balance. And again, I alluded to this before, the fact that if you're not balanced on your bike, again, for some of you who are just mainly exercising for fitness, that's okay. But if you're exercising for performance, that extra sway is going to cost you time, is going to cost you energy. So having good balance, and there are definitely some things you can do with Swiss balls and such that are very cycling specific to work on balance. That is also important consideration. So, and then sometimes we do need to make sure to consult several healthcare practitioners to receive the care to overcome the injury that's needed. And whomever your entry point is should be aware of things enough to consult those individuals. So if I see somebody and they have some medical issues, undiagnosed maybe medical conditions or further conditions that are outside my scope of practice, then I'm going to send you to that orthopedist, or I'm going to send you to that physician, I'm going to send you to the bike shop or wherever it might be to receive the appropriate care. So it definitely needs to be collaborative care amongst individuals, but it really depends upon your unique needs and the presentation itself. So along those same lines, and I've kind of, maybe the slides, maybe a slide too late right now, but wouldn't it be great if there was someone who was a cyclistologist? So it sounds like kind of a cool profession, but unfortunately there really isn't one. So right now it's a matter of, again, kind of finding professionals who have some experience and the expertise to kind of address the issues that you have from both a medical perspective, but also in addressing some of those external issues, which definitely involves somebody who has a good knowledge around a bike and how bikes are put together and getting the right equipment for that. These are just a few things, probably more from a medical perspective, but I don't know that's really pertinent to this conversation. So we're going to kind of breeze through these and maybe get to some questions if you guys have. One of the things that I did on the prior slide, and again, this kind of gets to some external issues. I think a lot of people have questions. They see some of the literature out on this as far as wedging cleats. This is just kind of an example, again, of how sometimes alignment can put undue strain on both ankles and knees based on sometimes just how we're put together. Okay, so some studies will state that up to 87% of us have a tendency of the front part of our foot to be twisted a little bit. And so, as you can imagine, the front part of our foot is really what's on the pedals, right? And so with that twisting like that, sometimes what that can do in the picture in red, that can cause your foot to try to meet the pedal, which causes the rest of your body to twist to meet its normal twist at the back of the foot, which then carries up the chain into the ankle and the knee. And so that can be corrected sometimes by changing the interface between the shoe and the pedal to kind of match that little twist in the front of your foot that you might have. Okay? And this is typically something that can be observed by anyone or addressed by anyone who does bike fitting. Okay? So individuals at bike shops are trained to the extent of which they can address these issues if they exist. But there are some other external things that might need to be addressed similar along these lines that involve actually kind of adapting the equipment that you utilize. So I referenced Dr. Andy Pruitt, definitely one of the foremost authorities and has tons and tons of experience in working with cyclists. So he's got a great text that talks about bike fit and gives some good information regarding that, both for you as a cyclist, but also information you can use when getting set up on your bike. And then for those of you who might be more interested in some of the science behind cycling, so you really want to know what the coefficient of friction is based on your tire width and the type of road that you're riding on. And you want to calculate that to see how that's going to affect your drag and your performance. So just tons of stuff like that is in this book by Dr. Burke, and it's a great resource along those lines. And of course, there's tons of other books, but these are just kind of two of the areas in which most people have some interest in, and it kind of covers it nicely in that area. So, well, I want to thank you for your attention and coming out, and we've got time now for questions. If you guys have any questions or yes, sir.
The numbness in your toes.
Yes.
Does that have to do with the angle you're holding your foot at, or is that just?
Yeah, so like the ankling.
Yeah, does the ankling increase, or I mean, is there an optimum?
It has the potential to, because if you're ankling, the other thing that's going to happen too is you might be shifting your foot inside of your shoe. I would say probably the most common issue with some of the numbness in the toes is usually shoe fit, and it's usually a shoe that's too tight. They like to fit cycling shoes fairly tight for obvious reasons, because if you have looseness in there, you're going to lose power, which is critical in cycling. But if it's too tight, and a lot of the modern shoes, they don't stretch that much, then, and especially as you ride, if you get any type of swelling in your foot a little bit, it's got no room to go anywhere, and so it's going to start to compress on those nerves, and you get that numbness. So shoe fit's a big factor, but you're right, there can be other things that can go into it. Some of that force performance, so conditioning, so a matter of how you're actually pedaling can affect that, especially if you're doing a lot of mashing. You can imagine, when I say mashing, it's really pushing down on the downstroke. Imagine climbing, you're doing a standing climb up a hill, you're pretty much mashing when you do that. You're always kind of forcing down. A lot more pressure through the interface of the front of the foot, which can cause some of that numbness as well. So, yes, ma'am?
I was just going to say I'm starting treatment on a neuroma on my right foot, so I just won't wear the cleats. But can you still wear the cleats?
Yeah, you definitely can. And sometimes, you can put some things in the cleat. It could be an orthotic, or maybe we modify something just specifically based on how your neuroma is presenting. So you can maybe offload it, so take the pressure off of it, or change the pressure to some extent. So there are definitely some solutions that can be provided for things like that, and they're not uncommon. So. Great.
So what do you offer here then? I mean, do you have to be referred here by a doctor?
Excellent question. So just in general, as far as physical therapy, in the state of Iowa, you can see your physical therapist for anything, okay? But it is up to your insurance as far as if they're going to pay for it. And so some insurances will require you to have a physician's referral. So I encourage you just to consult your plan, and you can call. A lot of times there's a number on the card. You can call and find out if your insurance requires a physician's referral or not.
I just have something to add on the pedal stroke.
Yes.
I have been told that instead of thinking of your pedal stroke as a completely round circle, if you think of it more as an ellipse, it helps your brain transfer that movement a little more. And on the top of the stroke, if you think of kicking a soccer ball, and then on the bottom of the stroke, pushing off like you're pushing a skateboard.
Yeah. Or scraping mud off your
Or
shoes.
scraping mud off your
Yeah.
shoe. Those are common
Yeah.
things that you hear, but if you think about it, the ellipse thing is what made it click for me. Instead of thinking of your pedal as a complete circle like a clock dial, more in that, it kind of helps you push across the top and pull across the bottom.
Emphasize those kind of lagging points, those empty points where
Right.
most people are.
You sort of naturally go up and down. I had a guy describe it, you should think about going back and forth.
Yeah, yeah,
And that sort of evens out your natural up and down.
yeah, definitely. Yeah, thank you.
Yeah.
Are there specific stretches that are particularly good for cyclists, like IT band and hip flexor and things like that that are perpetually a problem?
Yeah, in general. I see things just across the board. I would say with running I see more similarities, but I would say most cyclists, long-term wise, they end up getting stiffness in their mid-back. So a lot of times, going over a foam roller and kind of opening up your mid and upper back, can be very useful. I would say even stretching your upper neck, tucking your chin and elongating the back of your neck is also good, because oftentimes we spend time here and we're really kind of cranked up right in this area, which causes a lot of tension in through there. Hamstrings, if you think about on the bike, you're in that position, the hamstrings are not flexible. It's going to cause you to roll your pelvis one way or another. So hamstring flexibility would be another one. This is where I'd say cyclists are different from runners. Runners tend to be tighter through the front of the hips, which causes them more problems because they're actually going through a range of motion where their hips go back more. But when you're on the bike, you're mostly up in here. So you're working through more of that hamstring flexibility in that position. So having good hamstring flexibility and to some degree back flexibility is needed more so. Few people have this, not many, but if you see somebody riding and you can see their knees outside of their hips, that tends to be some butt muscles that tend to be tight when they're riding like that. But I would say that's less common. So, and usually people kind of just starting out. Any other questions? Yes.
So just a comment, if it can help prevent somebody else from having an injury. I'll just second that bike fit. I know that, going in and doing the drop with a little weight or whatever, the bike shop had told me you need to make sure that your bike is an inch shorter from your seat to your handlebar to fit you perfectly or better. And, I've had some previous back and things, and just, that's key. I think I totaled one bike, and so I was riding my mom's one that she had used, and that and any sort of upslip you might have of your sacrum can end up causing lots of IT band issues. But yeah, all that's.
There's a lot of repetition in cycling, and so that's the main issue. If you're not fit on your bike right, just all that repetition has the potential, to create undue strain, over and over. So even probably more so in some regards than cycling. Than running. So.
There's certain bike shops that are better at bike fits than others.
Well, it's probably not fair to me to comment too much on that. But most bike shops do a good job of having somebody who kind of has a little more expertise in bike fits. So I would just consult the local bike shop for that. I do have a few that I work just because of my more personal experience there, but most bike shops have somebody pretty well trained in that.
Well, in that, would there be certain questions, like if you're calling and checking around, that you would recommend asking to see if you think they're qualified to do it?
Yeah, that's a very good question. Part of, I guess, what you might say is, just ask about their experience, I guess, as far as if they have any, because typically, the bike fit methods I put up there, they do usually require some training. And so this individual from the bike shop, a lot of times it's not just somebody that, I fit my mom and my dad and things like that. If that's the case, I'd be a little more skeptical. But if they, just ask, what type of bike fit model do you use, and do you have somebody that's been trained in that? And if they've been trained, you can probably assume they've got a little more credentialing and ability to do a better job. So I think that would be the way I would steer you. So yes, sir.
As a rule of thumb, is there sort of a tipping point related to injuries for a typical bicyclist once you exceed a 50-mile ride or 75-mile ride, or at some point is the frequency of injury just dramatically increase?
Yeah, volume. I mean, in running we have some information on that. In cycling we really don't. Now actually, there is some information in the triathlon literature pertaining to that, but it doesn't really apply specific to cycling because these people are also swimming and running. And so their volume on cycling, it reaches a certain, they went by time, it's usually a 4 to 6 hour range where there were a little bit more risk of injury, but they were also putting a lot of volume as far as, swimming and running with that. But unfortunately at this point in time, no, we really don't know. As far as kind of some general rule of thumb or some information to kind of zone us in on that. But it definitely wouldn't be too hard to assess. It's just a matter of we need to design the study and we need to do it. Yes?
Are there different stresses or risks for triathletes because of the other disciplines?
Yeah, that's a good question. So if there's other risks for triathletes because they're doing multiple sports with there. And I would say a lot of it is related to volume. Again, generally in some of the running literature, there's a certain point of volume where you're more likely, there's more exposure, okay? But some of that also pertains to your training. So if you've kind of progressed into things fairly slowly, and you've progressed gradually over time versus just kind of jumping into it and going with a full head of steam and increasing your volume from hardly doing anything in any three of those sports to really putting in a large volume, there's a lot of risk then for bad things to happen at that point. So I think a lot of it really comes down to, I'd say most of the triathletes that I see, most of their issues are usually related to the running part of things. Not to say that things don't happen in cycling or the swimming by any means, because we definitely have issues in those areas, but it seems like things happen in the run, and a lot of it's just attributed to just not having a history and a significant conditioning with the running. And then the fatigue starts to play a role, and as we saw on the bike, fatigue starts to lead to sloppy mechanics. That's also going to happen in the pool as well as on land, and put you at a risk for injury. So the conditioning really is a big thing, I would say, along those lines. Doing it slow enough that you're allowing your body to condition itself to tolerate all of that and not compromise your technique in any of the different dimensions of the sport you're doing. So, good. Any other questions? My information is up there if something does come up. We do have some information up front too. I've got my card up there, as well as I think we've got our running and cycling clinic brochures out, so feel free to take those and to use myself and our clinic as a reference in the future if needed.